in healthcare professions. So we're not there, obviously. Globally, it is estimated that we need more than 4 million additional physicians, nurses, pharmacists, lab technicians, community health workers, and other frontline health workers. Serious shortage of culturally aware and credentialed faculty to provide quality training and continuing education. So in order for us to be able to even provide this type of training, that's going to be specifically addressing the gaps in the healthcare industry, we got to have the talent to be able to provide the training to meet the gaps. So then we need the educators. So that's another, it's another area that hasn't been, where there is a big gap in addressing. How am I with the time?
And we're gonna, let's wrap it up.
Yeah, okay, that's what I thought.
2 minutes, okay? We're gonna wrap it up. No,
I'm gonna wrap it up.
This is fascinating information you're providing. Please.
Thank you.
There's an appetite, obviously, but we have a limited time.
Yes, absolutely. I've been called a workforce nerd, so I could, talk about this for a long time. But there's very...
That's what we want to see, though, the entire year. I just don't like to have this conversation once a year. I go to General Assembly, and then I show up here again the next year. I need to connect these to policy, money, and results. But please, we can wrap up when you're ready.
Money and results. We see some of our issues that I just outlined earlier as a shared responsibility. So it's not, employers' fault, not education system's fault, it's not just the policy's fault. It really needs a comprehensive, collaborative effort, and we need to be honest about some of these gaps. And I mean from all sectors. We've had the luxury of, we've built every single program and every service that we have with many employers at the table. And I'm talking the big ones and the small ones. So we've been able to, immediately know what the shortages are, what competencies are needed, what types of certification is going to be needed, and make sure that we do everything possible to ensure that the skill sets of our students and our communities are going to be there. But that's not enough sometimes.
Yep.
And that's where policy.
And
policy is...
Go ahead, please.
Yeah, so policy is very key. And I'm going to close with just re-emphasizing that there's a need to be done to increase diversity in healthcare professions in order to realize the improved economic and healthcare outcomes of that result. There's a need and an effort to study and alleviate the barriers that keep Latinos from experiencing the virtues of education. We see an expanding role for technology. There's a need to look at technology to be leveraged more to address these gaps. Many healthcare problems among ethnic and racial minorities are either preventable or easily remedied. And I know my colleague will probably talk a lot about that. So we need more in access to prevention and affordable bilingual care, culturally incompetent and understandable medical information from a staff that is culturally sensitive to local population, and ensure sufficient numbers of healthcare providers to serve our population. So, policy.
That's right, and thank you. And segueing right into that, what I've heard, and she's taken some of my minutes because I'm going to keep quiet in a second, but we got to segue into the next speaker. But what it describes to me is also a need for data collection system that will, as she pointed out, when you talk about public health, education, and all of these avenues, finding a career path, we're talking about the state of Illinois being able to have a data collection system where we can have, to help close these socioeconomic gaps in healthcare so that we can cover all these areas and they can interact with one another, and we can go with a FOIA and get all this knowledge about this particular population in one place. With technology being the wave of now and the future, we're doing it in education. Duke University has a center on data collection. I have legislation on the Data Privacy Act, making sure that we don't, really pimp that information and sell it and use your information to market you, etc. So the Latino community really needs to have that data collected in all these areas so that then their work could be better gauged when they get out into the field. So that's what I would really challenge, and to start saying to grant writers, we need to put together a technological ability to gather that data. With that said, and she's brought up a litany, we should have a whole conference just on what Elba has brought up today. And it really, really disappoints me that I have to move on, because this is what everybody in mainstream is talking about as we're moving America forward. We need wave makers and innovators right now. And that must also be done in a STEM and everything in STEAM and items that we're going to. They cannot all just be for-profit schools. They must be reincorporated in our high schools, in our colleges, and that's how we start. But with that said and done, let's keep on moving, and let's keep in mind of the time, please. I have a timer on, and at 10 minutes, I will stop us at that moment, because time is going against us. So now we have Mr. Juan Salgado, and we go back for quite a long time, but no further ado. Juan, please introduce yourself and your title, and we got you on the clock for 10 minutes.
Gotcha. Try to finish at 9. But we do practice appreciative leadership in the Latino community. I think that's what makes us special. So I want to start by appreciating the National Latino Education Institute, because Mary and the organization was around, holding people accountable, at a time when there were few people holding people accountable to our organization. I see Carmen shaking her head. We appreciate Carmen's leadership, because, we live in a new world. We're still not in the world we want, but we live in a new world because there were people around at that time that were pushing accountability, right, and continue to push accountability. And Julio, you got to have people inside of government that can help you navigate government, and we need more people inside of government to help our community navigate the government. And I know, Carlos, you're working on that, and I know, Elba, you're partnering. You just said so. And when you said, Senator, that we're so blessed to have an amazing nurse on our panel. I want you to know that amazing nurse was there the moment 3 of my babies were born at McNeil Hospital. And that she came up to make sure that everything was well. And she doesn't just do that for me. She does that for every baby that's born at McNeil Hospital when she's able to be there. Right. And so, but to me, that's what makes us unique. That's why we need to be more in the healthcare sector, right? And of course to Andrew, right? Because, Andrew's running an organization that's of our own, We know what makes us special sometimes. We can't be completely special when we don't completely run things, right? But when we completely run things, we can really do some damage, right? Some positive damage, you know what I mean? And so, and I know, Senator Delgado, you've been all about, figuring out how we start running more things, right?
Yeah. Self-sufficiency is the solution.
Self-sufficiency is the solution. So I think, I think it's so important to appreciate, the different elements that we have, and to understand, what really drives our desire and where we should have common ground with private industry. But I want to talk about, the other beauty is that we've been building upon our strengths, right? And in the case of Instituto del Preso Latino, we started as adult education, Spanish literacy, English as a second language, working with, immigrant community, right? And that was our strength. And I think sometimes we build upon those strengths. And in our case, the work that we've done with Carreras en Salud has really been from that space, thinking critically about, wow, the people coming to us that are, in level 2 English, we can see them as nurses tomorrow, where, they walk into a lot of institutions, and those institutions don't see that possibility, right? They don't plant that seed. They don't create the specific mechanisms that allow that person to actually make it from where they're at now to where they need to go. There's always a roadblock, okay? And for us, there's always a way to get that roadblock out of the way, right? And we're actively looking at moving the boulder from the road, right? And that's what makes it unique and different. And we're using our strengths because that's all we got, right? And so we build upon that. And we're looking for systems change, right? Because it's not just about what we do, you know. What we do can help a good number of people. I'll show it, Caras en Salud. You know, to date, we've helped 70 folks become registered nurses. 319 become licensed practical nurses, 411 become certified nurses, right? That's a good contribution, but it pales in comparison to what needs to happen out there. And the institutions that we're working with, and in our case, what we do is we partner with the City Colleges of Chicago, and we'll partner with any community college that's out there. And why community colleges? Because they're affordable. And because they're more flexible, and because they have, you know, at least the right primary interest, not like these private colleges and universities that have another interest, which is a profit-bearing interest, right? So we partner with the community colleges, but part of our reason for partnering with community colleges is systems change. How do we make those institutions better? Because right now, the one thing I want you to leave with, right, is there's no community college in this entire state that is doing fully right by our community, okay? And we need to put pressure on them, you know, in all kinds of different ways to be better, to take more risks, to include our community, to take those adult learners. They have expansive numbers of adult learners, and to see them as nurses and to open up those spots in all of their allied healthcare settings for those folks that are coming from our community. Because basically that's what we've done. And because we've shown it can be done, right, you know, we can speak very affirmatively, right, that there's no excuse for you not to be able to do it. And by the way, if you want to learn how to do it, we're happy to help you. If you want to partner with us to help you do it, we're happy to partner with you, right? I mean, in some cases, the colleges should be coming to us and say, you know what, we'll give you this much money because you're going to make more money on the other end because we're going to get more students. That's not exactly happening yet, right? But we need to work to kind of make it happen. And we are as a community. And I think, you know, Senator Delgado, you know, that I think is the beginning of the conversation, right? Is how do we take, especially in this transition period, right? How do we take what's working and make sure that the people outside the community, people outside the caucus, the new governor knows what's working and now makes a commitment to put pressure on those institutions to start getting what's working for us, right?
That's correct.
And so I think that's a big next step that we need to take in this transition, right? You know, I can remember, Julio, when you guys asked us to go to the College of DuPage, and you asked us to go to a couple of other colleges, and the response we got from those colleges was, we don't need the help. We're just doing fine right now. But they're not doing fine right now. If you talk to the employers, they're not doing fine right now. If you talk to our community members, they're not doing fine right now. And so I'd like to kind of put that on the table. And I guess I know I'm probably close to the end of the time, right?
Yeah, about three minutes.
3 minutes, yeah. So I think, yeah, I mean, yeah, right. I'll help you, right? I'll end in about a minute, right? Because I think the biggest thing is to continue to make those systems change and continue to open up those doors. But I do want to say something about resources, right? Excellence drives resources, right? We've been fortunate, and we have to be driven to excellence. And so we just got through. We're part of a 10-year evidence-based study by the U.S. Department of Health and Human Services. Because we were able to show a lot of metrics, and over the last few years, we've been studied by the Aspen Institute, right, and a couple of other folks. And so, as a result of these studies, the U.S. government said, we want to study what you're doing, and we were able to get, sufficient resources not just to sustain our program, but to double it in size, right?